How do you relieve pain related to scoliosis? Hi, Dr. Chris Gubbels, and today I want to talk to you about managing or decreasing or potentially eliminating pain that's caused by scoliosis. So first, when we look at adolescence, some people have thought that adolescents or teenagers and children with scoliosis don't get pain, but some recent studies have actually shown that they do get pain. It's certainly not very high or intense pain, but a lot of times they have a low level of an ache. A lot of times that's around a 2 or 3 on a scale of 1 to 10, but they still get this low underlying ache or pain. Not all the time, but more than most adolescents would. Now, if you have an child or an adolescent teenager that has increased pain or pain at night, that's a red flag and it tells us there could be some underlying pathology. But in general, it's common for an adolescent with scoliosis to develop some kind of low-level pain. Now, in adults, we know that there is higher incidence or prevalence of back pain for people with scoliosis compared to those that don't have scoliosis. Some studies have also shown that the severity of the scoliosis is directly proportional to the severity of the pain, meaning the bigger the curve of someone's scoliosis, the more likely they are to have more severe pain, and that pain is generally likely to affect them over a longer period of time. I want to distinguish pain from just an average adult that has back pain and how that's different from adult with scoliosis. First of all, adults with scoliosis typically get pain on one side, meaning it's asymmetrical, and they most common have the highest area of pain where they have the peak of their curve or the apex of the curve. In adults without scoliosis, generally the pain is more centralized and it's equal on both sides. Adults with scoliosis generally get referred pain or pain down the front of their thigh. And that's because a lot of times when you have a lumbar curve or lumbar scoliosis, the peak of that curve is around L2 or L3 or L1. And so it affects nerves that are a bit higher in the spine, and those nerves go to the anterior thigh or groin area. Most adults that have non-scoliosis related back pain have problems in the lower two vertebrae, L4 and L5, and that's going to impact your L5 and S1 nerve root, which can cause what's known as sciatica, or pain going down the back of the leg. So a little bit different pain patterns when we look at adults with scoliosis compared to adults that don't have scoliosis. A couple of other things that can impact pain in scoliotic patients is if you have a big shift in coronal balance, meaning your body's not aligned, you're dramatically shifted to one side. Especially if that gets beyond 4 centimeters, that's a really high predictor of pain. Another high predictor of pain is when you have changes in your sagittal balance. A lot of times adults with adult degenerative scoliosis, along with their curve in the front, they start to get a forward lean. This is called sagittal balance, and when you get a large anterior sagittal balance, that's a high predictor of disability from back pain. Also with lumbar scoliosis, as the spine twists, people lose the normal curve in your lumbar spine. And when you lose the curve in your lumbar spine, that is a very high predictor of chronic pain. So all these are basically spine deformities: scoliosis, anterior sagittal balance, loss of normal lumbar lordosis. Those can all be classified as adult spine deformity, which is a huge problem and huge cause of pain. Adults with scoliosis report that their pain most frequently bothers them when they're standing for long periods of time, or they're sitting for long periods of time, when they get up and they walk. It can also affect them when they're bending or picking things up. So adults with pain, a lot of times in scoliosis, it's about getting their functionality right, because it really starts to negatively impact their quality of life. What do we do about this? A lot of people, a lot of times, seek out possible pain medications, which pain medications are sometimes okay in very short periods, but long term they can have a lot of negative side effects. Some can cause digestive issues, some can affect liver and kidney health, and some of those, like opioids, can be very addictive and create all different kinds of problems. So you really want to avoid relying on medications to reduce pain. People will get injections. This could be an injection to the facet joint, or the people may also get radiofrequency ablation, where they actually go in and they burn the nerves in the spine so they can't sense pain. Now, these may provide some short-term relief in pain, but they're not a great long-term solution. If you get your nerves burned, those nerves do grow back, and if you get an injection like a steroid injection, one that's going to short-term reduce inflammation, but it can actually cause weakening of the ligaments and connective tissues, and it can cause the spine to break down and degrade potentially even faster. You want to look at what long-term solutions are. The ones that have been shown the most effective for reducing pain are one, custom scoliosis bracing. And a recent review paper looked at patients that went 10 years without doing any kind of treatment or wearing any brace, and their back pain and the degree of the scoliosis kept progressing over time. On average, their curve got about 1.5 degrees worse per year, so over 10 degrees, that's on average about 15 degrees worse. And what they did is they found when the patients started wearing a custom brace just 4 to 6 hours a day, they had dramatic decrease in pain levels, but also a dramatic decrease in the progression of the scoliosis. The most effective treatments are custom bracing and scoliosis specific exercise. And how does this differ compared to regular exercise or regular physical therapy? I want you to think of it like this. If someone has a major misalignment in their body, where they're shifted to one side, or they have a big anterior sagittal lean, we want to bring the body back into balance. We want to reduce the size of the misalignment first. Once we reduce the size of that misalignment, then we want to do stabilizing and functional exercises with the spine in correction. We don't want to stabilize the spine in a male position. We want to put the body in the best position it can be in, the most corrected it's able to go in, and then strengthen and stabilize the spine. So when you're looking at pain long term, the best treatment options are custom scoliosis bracing, especially in adults, depending on where the curve is, but especially for thoracolumbar or lumbar curves, adults respond terrific to custom bracing. Also, scoliosis specific exercises to one, put the spine in a more correct position, but then to strengthen and stabilize the spine when it's in that corrected position. Now you can combine that things with like chiropractic care and acupuncture and massage and yoga. Those are all additional things that may help. Things like ice, things like heat may give some term relief, but that's short-term relief. You have to do the bracing and the exercises for the best long-term outcome. Now, it's important to remember with adults with pain and scoliosis that we're not really curing the scoliosis. We are effectively managing, but if we manage the curves properly, we know that the long-term outcomes are greatly better for patients, and what that means is people are going to be able to function better, have less pain, and have a dramatic improvement in overall quality of life.
So if you're finding this information useful, like, follow, or subscribe, and share with others you think would benefit from this information. And if you have scoliosis or you have a child that has scoliosis, don't hesitate to reach out. Just give our office a call and ask for a free consultation to see if there's something we can do to help you.